of sort of stigma in the healthcare setting.
Such a forum, which is held quarterly, is geared towards sensitization, information sharing and policy making on key development issues for the UNDP, the Gambia government and their respective development partners. Speakers such as Dr. Adama Sala and Dr. Lamin Sidibe gave detailed statements on issues relating to stigma and discrimination.
To stigmatize, actually, is to mark out as bad, to reproach. And stigma is very closely linked to what we call in psychology stereotyping. Stereotyping in itself is resistant and it's a fixed perception and it is persistent also.
Fear of stigma and discrimination can cause pregnant women to avoid voluntary counseling and testing, which is the first step to reducing mother-to-child transmission. It may force mothers to expose babies to HIV infection because using alternative feeding methods other than breastfeeding, especially in the rural communities, may arouse suspicion of their HIV status.
The forum was no one-way traffic in relation to information sharing on HIV/AIDS and its challenges of stigma and discrimination. Therefore, questions, views and experiences were shared by participants as soon as the floor was open.
Many studies that have documented empirical evidence of stigma and discrimination manifested in this country. So it is nothing new. And I think we need to move a step ahead. Of course, our landed Dr. Carroll has talked about the Constitution. But I think in addition to that, we need HIV-specific laws that we need to enact to be able to protect people in different circumstances.
We are facing a lot of problems, a lot of challenges. So we want people to change their attitude, not only in the family, but even in the health setting. We are having problems. It even stop others to go for their treatment. Some people are not even going to health centers because of stigma, especially women. We are having complaints about some people saying that I am not going to this health center so and so because of somebody is there and if she sees me, she is going to talk about me.
For Betty Jatta, AIDS, despite being a deadly pandemic, is preventable, and as such, Gambians, especially those who are sexually active, should go in for voluntary counseling and testing. Having thanked UNDP and their partners, she appealed for more sensitizations on stigma and discrimination, since it is proven to be preventing many individuals from checking on their HIV status, thereby spreading the virus. Given that development in whatsoever forum should pay considerable interest to people's health, this UNDP Development Forum, focusing on HIV/AIDS-related stigma and discrimination, may serve a significant step in the fight against the pandemic. Modu Bajan, Grts.
Well, forces loyal to former South Sudanese vice president captured two major towns, and days after serious skiing accident, Formula One legend Michael Schumacher remains in a medically induced coma. We will look at these stories when we return.
nañ leen ko macc neex na waaye xam nañ koo maccee ko dàq dama wax ne li mu saf billaahi ka ko tax xam ci ku rek moo ko xam tey jëli ba oote na ci réewi Gambia ànd ak kan kumaare ban fas yéene ubbi nag albumam bu ees album boo xam ne naka la tudda ñu ne Aliou Tujee lum tekki bàyyi leen ma rek lu ma def baax na ak ban ñu de ko wax Wally Saboo lum tekki ñetti façon ngi wàllu moo am ci àdduna bi moom la jëli ba nag fas yéene ubbi Aliou Tujee ak Wally Saboo kañ la koy lonc ba si samedi la di ñeneenti fan ci weeru janvier fan la ko loncee ca Sahel Fitness Center ca boori Coco Ocean Hotel ma ne kañ lay tàmbali juróom-ñeneenti waxtu waaye ticket bi yomb ba dee ñetti téeméer di $300 rek la jële ba nee na bés bi nag dafa am ñu ma invite su may mbokki artiste nag la ci bés bi kan la Viviane Sidit ma ca Sénégal di woy mu neex mu tofal ci kan Balla Gaye 2 mi bëri te safoo ñëpp safoo ko ñoom la oo ci bés bi réewi Gambie jóg leen jëri baat ko yaate ànd ak kumaare ban cey lii neex ba dee ci 2014 bi
Welcome back and off to the international scene. South Sudan media say the President Salva Kiir has declared a state of emergency in 2 states with 2 major towns under rebel control. The report also says that President Kiir has sent a negotiating team to Addis Ababa for peace talks. CNN senior international correspondent Awa Damon is in the South Sudanese capital of Juba and tells us more about the situation on the ground in relation to the 2 states that are under a state of emergency.
Those states, Unity and Jonglei, are where much of the violence has been concentrated. Unity is also home to a lot of South Sudan's oil fields. Jonglei itself, the town of Bor there, has been going back and forth between government and rebel control. It is currently in rebel control, and there have been some clashes, although the violence has not been as severe. The fighting has not been as severe, according to the UN today, as it has been in the past. We heard earlier in the day from the UN Special Representative here, Hilda Johnson, who was saying, though, that even if these talks do lead to a ceasefire, the violence in this country may not necessarily end.
There has been killings and brutality, grave human rights violations and atrocities committed. We are seeing evidence of apparent ethnic or targeting of South Sudanese citizens on ethnic grounds. This can lead to a perpetual cycle of violence that can destroy the fabric of the new nation.
It is really going to be up to the forces, the key players at this stage, President Salva Kiir and Riek Machar, to try to come together, end the violence, and make sure that that cycle of violence, that ethnic killing, does not continue in this country. And of grave concern, Fanula, at this stage is not just the impact that the violence is happening, but also that the violence is having, but also growing concerns about the health of many of this war's youngest victims.
And Arwa, given the backdrop of this violence, how much of the country is affected? How many people have been displaced from their homes, and what kind of conditions do they face in the UN or other humanitarian camps they go to?
It's a very dire situation, Fanula. There are around 180,000 internally displaced people, and that's only the figures that the UN is itself aware of, and less than half of them are at UN compounds. And even those who are at UN compounds are facing a number of risks.
3-month-old Ron has diarrhea, a fever, and cough. His mother, Elizabeth, is just 15 years old, married at 13 after her mother passed away. He wasn't sick like this at home, she tells us. I'm worried he will not be all right.
The baby is very brave.
Her concern is justified. Most of the cases arriving at this mobile clinic, set up by Doctors Without Borders at a UN compound in Juba, are severe diarrhea.
Diarrhea can kill a child really fast if the dehydration is very severe and we cannot treat it straight away. Yes, it's quite dangerous. It's one of the first killers in the world. And it's the same for malaria also.
Tents and sheets provide some shelter from the sweltering sun for those too ill to move. Adults lie listless, waiting to see the doctors. The vast majority of them also have severe diarrhea. Conditions out here are abysmal, although better than when the refugees first streamed in. Clean water is in short supply, despite the tanker loads being brought in. Hardly enough for drinking, bathing, and washing.
Down there are some of the latrines that have been set up by UNICEF, but despite aid agencies' best efforts, these are hardly sanitary conditions. And this is just one of the factors that is contributing to growing concerns about the spread of various diseases.
The population density at this UN camp is said to be equivalent to 10 times that of Mumbai, one of the world's most crowded cities. Such cramped conditions create the potential for even greater suffering.
If we get any one of those contagious or disease outbreak, that will be a big issue because we are maybe not really ready to respond for the meantime. Like cholera, like measles,
Immunizations are underway for polio and measles. But of even greater concern are the children who didn't make it to UN bases, don't have access to treatment, and have reportedly fled into the bush without access to water, food, and medicine, potentially leading to more innocent lives lost to a war few can understand.